Welcome to American Medicine Today, presented by the Bonati Spine Institute, featuring internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Here are your hosts, Kimberly Bermel-Bonati, and co-host Ethan Euchre and Jeff Wagstaff.
Thank you for listening to American Medicine Today. I am Kimberly Bonati, joined by the gang, Ethan Euchre and Jeff Wagstaff, as well as world-renowned orthopedic surgeon, Dr. Alfred Bonati. Now, North Carolina public health officials have announced a major reporting error in the number of COVID-19 tests conducted since the start of the pandemic. So can the numbers be trusted? And this is happening everywhere. Joining us to discuss is Dr. Al Johnson, a doctor of internal medicine and women's health at Johnson Medical Associates in Dallas, Texas. Thank you for being with us, Dr. Al.
My pleasure.
Now, Dr. Al, why do you think there are so many errors in the testing, and do you think that it's inflating the numbers? I mean, we kind of know the answer to this.
Well, there's a lot of issues at play. One is developing test for a new virus and getting it validated is one problem. Sampling can be another problem on how it's sampled. Then instituting those new tests, making sure that controls are normal and are done correctly, and then just getting the patient sampled and the samples to the lab, and the lab being able to run the test and then get it back. It's a major undertaking on developing the new test.
Mm-hmm. And so many people are trying to say that maybe it's a conspiracy against Donald Trump to get him out of office. What are your thoughts?
Well, in my opinion, what we've run across is bureaucratic type regulations and holdups in the sense that they want everything perfect. In war or in a pandemic, you aren't going to have everything perfect. You're going to have to go with what you have as the best thing at the time and then modify it as you go. And I think, they tried to do that and has done a pretty good job of doing that. It's just not what's been satisfactory for some of the media and getting as many tests out there as possible. Getting those tests out there and getting them instituted is difficult. Many of the major labs have trouble in turnaround times because of numbers. I personally use a private lab that's CLIA certified, and I can get the PCR nasal test back within 24 hours.
24-hour turnaround. That's great. Mm-hmm.
Yeah, and that lab is a Texas lab, and they have capability running 50,000 tests a day with their equipment.
You bring up a good question. There's so many tests being done. Who really needs to be tested? Does everyone need to run out if they sneeze suddenly, or if somebody clears their throat? I think it's mass panic where everyone goes, oh, do I have COVID? And then some people go, no, it's just your typical cold. When do you know when to get tested?
Well, that's a really good discussion, because ideally, if we knew everyone at the same time that had an infection, then we could isolate those people and probably be done with it.
Sure.
But we don't have that capability. So then the question is, what capabilities do we have that would best protect us? So if, like, starting back in school, if you could test everybody on the first day of school and find out who's positive, who's negative, or the day before, and then you could screen out who was positive and negative, you'd decrease the risk of someone being there that is infected that would infect someone else. Same way in the workplace.
Right.
And so now the initial testing situation was only if you're really having symptoms do we test you, and then sometimes we don't do that. We just treat you when you get in the hospital and are that sick. It's been my personal experience that if I test them and they come up positive and they have a few symptoms, then to treat them immediately. And in medicine, the sooner you treat a disease process, the sooner you catch it and have intervention, the better the outcomes are.
Absolutely. Well, unfortunately, we're out of time. Thank you so much for being on, Dr. Al Johnson, Doctor of Internal Medicine and Women's Health at Johnson Medical Associates in Dallas, Texas. Thank you for being on to discuss all those COVID errors and how those testing companies can fix the problem. Thank you for being on the show.
You're welcome. My pleasure.
Thanks,
Take
Doc.
care.
Thank you, sir.
Well, make sure you stay tuned. Coming up after the break, we're going to speak to Madeline Westerhout about her book, Off the Record. Are you really ever off the record? Stay tuned.